Welcome to another video of Clinical Haematology Unit 5, V-2, Haematological Techniques. Let's dive. 1. Different stains for blood smear. Blood smears are stained to identify and differentiate blood cells. Common stains include Romanowski stains, Leishman, Wright, Giemsa, May-Grunwald. Used for routine examination of blood films. Differentiates white blood cells, WBCs, red blood cells, RBCs, and platelets. Wright-Giemsa stain. Common in hematology labs. Highlights cellular details, useful in diagnosing anemia and infections. Supravital stains, new methylene blue, brilliant crescel blue. Used for reticulocyte count, immature RBCs. Prussian blue stain. Detects iron deposits in RBCs, siderocytes. Sudan black B, SBB, and myeloperoxidase, MPO, stains. Helps differentiate acute leukemia subtypes. 2. Hematological tests and their significance. 1. Total blood cell count, CBC. Includes RBC, WBC, and platelet count. Used to detect infections, anemia, and blood disorders. 2. Differential leukocyte count. Identifies percentage of different WBC types, neutrophils, eosinophils, basophils, lymphocytes, monocytes. Important in diagnosing infections, leukemia, and immune disorders. 3. Erythrocyte sedimentation rate, ESR. Measures the rate at which RBCs settle in a tube. Elevated in inflammation, infection, and autoimmune diseases. 4. Hemoglobin, HB. Determines oxygen carrying capacity of blood. Low levels indicate anemia, while high levels suggest polycythemia. 5. Packed cell volume, PCV, or hematocrit. Measures proportion of RBCs in blood. Low PCV suggests anemia, high PCV may indicate dehydration or polycythemia. 6. Blood indices. Mean corpuscular volume, MCV, indicates RBC size. Mean corpuscular hemoglobin, MCH, measures hemoglobin per RBC. Mean corpuscular hemoglobin concentration, MCHC, reflects hemoglobin concentration in RBCs. Useful in classifying anemia types, microcytic, macrocytic, normocytic. 7. Reticulocyte count. Measures immature RBCs. Increased in hemolysis and blood loss, decreased in bone marrow failure. 3. Staining of bone marrow smears. Bone marrow smears help diagnose hematological disorders. Wright-Giemsa stain most commonly used. Iron stain, Prussian blue, detects iron stores and iron deficiency anemia. Periodic acid Schiff, PA, stain identifies abnormal glycogen storage in leukemia. Sudan black B and MPO stains differentiates myeloid and lymphoid leukemia. 4. Errors and precautions in hematology. Common errors. Improper blood collection, leads to clotting, hemolysis, or contamination. Incorrect staining technique, can affect cell morphology and identification. Improper smear preparation, affects cell distribution and morphology. Wrong anticoagulant usage, EDTA for CBC, citrate for coagulation tests. Precautions. Use fresh, well-mixed blood samples. Ensure proper drying and fixation of smears. Follow standard protocols for staining and microscope examination. Avoid air bubbles in blood smears. 5. Quality control in hematology. Internal quality control, IQC. Regular calibration of hematology analyzers. Use of control blood samples for accuracy. External quality assurance, EQA. Participation in proficiency testing programs. Standard operating procedures, SOPs. Ensure consistency in testing and reporting. Proper training. Regular workshops and updates on hematology techniques. MCQs on blood smear staining, hematological tests, bone marrow stains, and quality control. 1. Which of the following stains is commonly used for routine blood smear examination? A. Gram stain. B. Wright-Giemsa stain. C. Ziehl-Neelsen stain. D. Sudan black B stain. Answer, B. 2. What is the primary purpose of a supravital stain like new methylene blue? A. To differentiate WBCs. B. To stain bacterial infections. C. To identify reticulocytes. D. To detect iron deposits. Answer, C. 3. Prussian blue stain is mainly used for detecting A. Reticulocytes. B. Hemoglobin concentration. C. Iron deposits in cells. D. White blood cells. Answer, C. 4. The total blood count, CBC, does not include A. WBC count. B. RBC count. C. Hemoglobin level. D. Blood sugar level. Answer, D. 5. Which hematological test is used to measure the rate at which RBCs settle in an hour? A. Hematocrit. B. Erythrocyte sedimentation rate, ESR. C. Reticulocyte count. D. Differential leukocyte count. Answer, B. 6. A low hemoglobin level is indicative of A. Anemia. B. Polycythemia. C. Leukemia. D. Hemophilia. Answer, A. 7. Packed cell volume, PCV, is also known as A. Reticulocyte count. B. Hematocrit. C. Hemoglobin concentration. D. Blood indices. Answer, B. 8. Mean corpuscular volume, MCV, measures A. Hemoglobin concentration in RBCs. B. Size of red blood cells. C. Oxygen carrying capacity. D. White blood cell count. Answer, B. 9. Which stain helps differentiate myeloid from lymphoid leukemia? A. Ziehl-Neelsen stain. B. Sudan black B stain. C. Leishman stain. D. Giemsa stain. Answer, B. 10. Reticulocyte count helps assess A. RBC production by the bone marrow. B. Iron levels in the blood. C. Clotting time. D. Total WBC count. Answer, A. 11. Which of the following is not a cause of error in blood smear preparation? A. Using fresh blood. B. Incorrect staining technique. C. Uneven smear thickness. D. Air bubbles in the smear. Answer, A. 12. Which anticoagulant is most commonly used for a complete blood count, CBC? A. Heparin. B. Sodium citrate. C. EDTA. D. Potassium oxalate. Answer, C. 13. What is the significance of differential leukocyte count? A. Measures RBC production. B. Identifies WBC percentages and detects infections. C. Determines hemoglobin levels. D. Detects platelet abnormalities. Answer, B. 14. The periodic acid Schiff, PA, stain is useful for diagnosing A. Tuberculosis. B. Glycogen storage diseases and leukemia. C. Malaria. D. Anemia. Answer, B. 15. What is the normal range of ESR in an adult male? A. 0 to 10 mm/Hr. B. 10 to 20 mm/Hr. C. 20 to 30 mm/Hr. D. 30 to 40 mm/Hr. Answer, A. 16. A higher than normal reticulocyte count suggests A. Bone marrow failure. B. Active RBC production, e.g., after blood loss or hemolysis. C. Anemia due to nutritional deficiency. D. Decreased iron stores. Answer, B. 17. The primary objective of quality control in hematology is to A. Reduce blood collection. B. Ensure test accuracy and reliability. C. Speed up test results. D. Minimize reagent usage. Answer: B. 18. Which of the following is a part of external quality assurance, EQA, in hematology? A. Use of daily control samples. B. Participation in proficiency testing programs. C. Manual checking of each test. D. Reducing the number of tests per day. Answer: B. 19. Which of the following is an error in hematological testing? A. Proper blood collection technique. B. Using the correct anticoagulant. C. Inadequate mixing of blood samples. D. Following standard operating procedures. Answer: C. 20. The role of standard operating procedures, SOPs, in hematology is to: A. Ensure consistent and accurate testing. B. Increase the number of samples tested daily. C. Reduce costs of laboratory reagents. D. Shorten the time needed for testing. Answer: A. If you guys like the video, then like, share and comment and subscribe the channel. Thank you.